Oh wow, welcome back. We are again talking about pathology. We're going to talk about some hematology. We're going to talk about anemias. We're going to talk about leukemia, anemia, thalassemia, sickle cell anemias, megaloblastic anemias, Hodgkin's, non-Hodgkin's lymphomas. We're going to talk about pulmonary problems. Anyway, let's start off with some basics, some very basics. What is polycythemia? This is increased levels of red blood cells. Let's think about the basophilic erythroblast. Can you describe the process of maturation of the erythroblasts? So first we have a proerythroblast, then a basophilic erythroblast, then a polychromatic erythroblast, then an orthochromic erythroblast. What does it mean when you hear the word megaloblastic? Well, this is talking about pathologic red blood cells. We're going to talk about these more in detail later. So let's talk about the reticulocytes a little bit. We know that the large immature red blood cells typically compose how much percent of the red blood cells in the human body? About 1%. So the reticulocytes are about 1.5%. When I say that, I mean that the reticulocyte count, or the percentage in red cells in peripheral blood, is about 1.5%. And we know that they do not have a nucleus, but they do have a reticular mesh-like network of rRNA. What is rRNA? What is the role of rRNA? Remember that this is the role for, their role is to make proteins, which actually they're making the ribosomes that make proteins. And what is the protein that's made by the reticulocytes? Of course, that's hemoglobin. And what is it that the reticulocyte count is measuring? When you look at a reticulocyte count, that measures how fast red blood cells are being made for whatever reason. So talking about the reticulocyte count, what if you saw 5% in an infant? Would that be worrisome? No, that would not be worrisome. How about in high altitudes, what would you see regarding the reticulocyte count? You'd see a higher rate of reticulocyte count to adjust for the low oxygen levels. Let's talk about the mean cell volume. How is the mean cell volume measured? This is measured with a femtoliter. How about MCH? What does MCH stand for? Mean cell hemoglobin, which is the average content of hemoglobin per red blood cell. And how is this measured? This is measured by pilogram. How about the MCHC? This is the mean cell hemoglobin concentration, and this is measured by grams per deciliter. Okay, let's cover the basic adult ranges for red blood cells. So remember, for the main ones, the hemoglobin, hematocrit, and red blood cell count, there are differences between men and women, but for the reticulocyte count, mean cell volume, mean corpuscular hemoglobin, mean corpuscular hemoglobin concentration, RBC distribution width, it's about the same for both men and women. So what is it that's usually higher in men? Hemoglobin, hematocrit, and red blood cell count. So how about for the hemoglobin for men? What is the range? That's 13.6 to 17.2. How about for women hemoglobin? 12 to 15. How about hematocrit? Hematocrit for men is what? 39 to 49. And for women? 33 to 43. Red blood cell count? 4.3 to 5.9. For women, 3.5 to 5.0. So now let's talk about the changes in bone marrow location from an embryo to an adult. Where is bone marrow in the embryo? It's in the yolk sac. Where is it in a newborn? In the liver and the spleen, but mostly in bone. How about in a child? It's in the axial skeleton and appendicular skeleton. But remember that both have red active marrow. How about in the adult? Where would you find the bone marrow? In the axial skeleton, you'd find the red marrow, and the appendicular skeleton has only yellow marrow. But remember that the yellow marrow can be converted to red marrow when needed.